I don't know about you, but since mid-March, I've been looking forward to having some normalcy return to our lives. As we begin the school year, we've started to become accustomed to a new normal. We in the Southwest Public Health District and here in Curtis are blessed to have some freedom that other college campuses aren't able to enjoy just yet. Our ability to learn, engage, teach, and be free to be normal is all predicated on the goal of keeping our campus healthy. Keeping our community healthy is everyone's responsibility. Our ability to meet face to face with limited mask wearing is a privilege we can enjoy as long as there are no cases of COVID-19 on campus. As a member of our community, you must do your part to protect our community and be safe. Part of being safe is taking your temperature daily, wearing a mask when required, washing your hands often, and using hand sanitizers that we have placed around campus, and maintaining a social distance whenever possible. Please understand that the most important thing is the health and safety of our students, faculty, staff, as well as the entire Curtis community. If we lived in a bubble, with every one of us coming from Frontier County, we would look at things a lot differently. While we may not live in such a bubble, we do have the responsibility to create and maintain as safe and secure a bubble as possible. Many of you are joining us this fall from across the state and from other states. Many of you will likely travel home on weekends, and we will not expect you to self-isolate for 10 days before you return to your classes. We need you to be smart, to be safe, to be careful, and to return to campus without having been exposed to the virus. Doing so is the only way we can continue to operate with the freedom we enjoy now as we start the school year. This is our best chance to protect the bubble we are trying to create here on campus. So here's my challenge to you. Protect our bubble. Do everything you can to make sure you stay healthy. Don't come to class if you're feeling ill. Contact your RA and your advisor to let them know what's going on. Let's keep our bubble clean and safe. Thank you.
Thank you, Dr. Gosen, for that introduction. I'm Jennifer McConville, Associate Dean of NCTA, and I'm going to spend the next few moments just going through the NCTA Health and Safety Plan for COVID-19, just so you have an idea how things are going to look on campus, what you can expect of us, and how you can help keep everyone safe. Now, the first thing you'll notice as you walk around campus is that there will be signs posted reminding us ways to be safe. They are in the bathrooms, they're in the hallways, they're in the dorm rooms. We've got them in most locations around campus. These signs will remind you to keep social distance from each other, stay 6 feet apart, remind you to wash your hands regularly, just safety reminders throughout campus. So when you see one of those signs, take a few moments and just read them and be aware of what's going on around you. You're also going to find that we have hand sanitizing stations all throughout the campus. Now, some of them are going to look like the picture on the right with the big giant hand sanitizer at the entry of the buildings. More often, you're going to find a stand by the door that's going to have masks on it and cleaning wipes and some hand sanitizer. Go ahead and use whatever you need to help keep you safe. We are also making sure we continually clean and sanitize all high-touch surfaces throughout the campus. And we keep a log so we know when those have been done. In addition to our own custodial staff doing this, we have also hired a professional staff that comes in and helps with cleaning. In addition to the policies we've talked about on campus, you're going to find that we have just a few extra in the classroom, and you might be asked to help out with that. After you leave a class or on your way out, a professor might ask you to help by wiping off the desks or chairs, the areas that you sat in, doorknobs, light switches, any equipment that was used. And that's going to look different on every classroom. I can't go through and list all those. Just talk to your instructor and see if there's anything they need you to do to help with this process. And there's also a log that we need to fill out every time this is done. So we just need to put the time that it happened, that you cleaned the room, and your initials by it. You also might find some instructors are going to ask you to help by grabbing a disinfectant wipe when you enter the classroom and wiping down the area you sit in before class starts. So work with your instructors and they will help figure out a process for each classroom. Although currently at the time of this recording, all restrictions have been lifted in our public health district, we are still taking a few extra precautions in the classroom. And one of those is that we are limiting classroom size to 75% occupancy, just so we can spread out a little bit and have more room to social distance. NCTA is also recommending face masks be worn on campus, and in the class settings, they are not required. They, however, can be required by faculty members in lab settings where social distancing cannot be achieved. So your instructor will help you work with those situations and figure out when it's going to be needed to be safe. You also might find a situation that an instructor is a high risk of getting COVID-19, and they might require the students who don't have face masks or face shields on to sit 16 feet back from the instructor. Otherwise, you might see some classrooms have plexiglass or plastic shields are installed so that the professor can stand behind them. So please be respectful of those barriers if you see them in the classroom or even in office space. Something to think about if you go and visit your faculty member during office hours, maybe for advising or to talk about a homework assignment, they can require masks or shields to be worn in their individual offices. On campus, both Shandy's Castle and Aggie Dining Room are open for service this semester. Aggie Dining is in the cafeteria, and that is going to be a buffet style line, same as it's been for years. And the one thing we do ask if you are eating in the cafeteria is that whenever you are going through the buffet line, that you wear a mask and either use hand sanitizer right before you go through every single time or put on a pair of clean gloves. And there's going to be masks and gloves in the cafeteria for anyone that doesn't have one. This would be a good time for me to mention, though, that I would just recommend keeping a mask on you while you walk through campus, even if you don't have it on. That way, if you need to talk to someone in their office or go through the food line, you'll have your mask. Because we want to prevent an outbreak of COVID-19 on our campus or in our community, we are going to ask that everyone who is part of NCTA self-check their temperatures each morning before coming to work or coming to class. So that's really a simple process. If you live in the dorms and you don't own your own thermometer, each dorm has a scan style thermometer you can use. I'd recommend just taking your temperature, kind of getting a baseline for what's average for you, just so you have an idea of what to look for if you start getting sick. Now, anyone that does have a temperature of 100.4 degrees Fahrenheit, or if they're feeling ill, must stay in the dorm room or home. And they need to isolate until their temperature is back to normal for at least 24 hours. And if the symptoms persist, we're going to ask you to contact your doctor or healthcare professional. If this situation would happen to you, don't panic, just contact your RA and we will work you through the process and put you in touch with the medical clinic here in town so we can figure out your best options. If you happen to be diagnosed with COVID-19, we are going to ask you to self-quarantine for 14 days, and we will only allow you to return to campus once you have a negative test done by a qualified health professional. Now, how this will work if you live in residence life is that we do have isolation rooms that you can move to and you can quarantine if you decide to stay on campus and not go home. We will still help take care of you. We'll make sure food service provides your meals. They'll be brought to your room every day. We just need you to send a text message to your RAs and we'll work out a plan. Residence Life has been working on an isolation policy and they will be visiting with you about that as you move into the dorms. Something else is that contact tracing will be implemented, and if there are any confirmed cases, all their contacts will also be asked to self-isolate until they are deemed to be COVID-free. If you are uncomfortable with these policies and you would like to consider taking courses virtually, if it's possible to offer your class virtually, please contact Kevin Martin in Student Services. His office is located in the Welcome Center, and we will make arrangements on a case-by-case basis for these situations. Faculty will also include an accommodation statement in their course syllabi to help accommodate students with documented disabilities as it applies to COVID-19. And one last thing, as a common courtesy and out of respect for other people, if you are on campus or even in the community and you're talking to someone or working with someone who is wearing a mask, just be polite and put on your mask or make sure you maintain an appropriate distance. We are working together to keep our community safe, and we need each of us to play our part in this. As we wrap up our video on the NCTA COVID-19 Health and Safety Plan, we want you to remember that the health and safety of our students, faculty, and staff, as well as the Curtis community as a whole, is the most important thing to us. We are very intentional that our classes will meet in person in every situation possible. Keeping that in mind, that's going to depend on what you do. So it might be worth just a little inconvenience to keep our community safe. Now also remember that these plans that I just discussed with you are strictly for the immediate future, the fall 2020 semester. They are subject to change. If our health district would move us back to a phase 3 for any reason, we'd have to revisit the policy and decide what would be best for our campus as a whole. So remember, we need you to help us do the right thing to keep the needle moving in the right direction. If you have any questions about this video or our COVID-19 policies, I encourage you to contact the Dean's Office. You can call us at 308-367-5200. Or we are located on the second floor of Ag Hall. Our offices are always open. We'd be happy to discuss this with you.